Hello, and welcome to LEMD's Alive Educational Series. I'm tonight's host and LEMD's social media manager, Brenda Rios. We're so glad you're here as we continue our mission to educate, inspire, and empower you on your health journey. Today's episode is part of our Men's Health series, where we take a deeper look at the foundations of men's vitality, including energy, stress resilience, cognitive performance, and longevity. At LMD, we go beyond telehealth. We're building a community rooted in education, innovation, and personalized support. This series is one more way we're equipping you with the tools, strategies, and science backed insights to thrive at every stage of life. Tonight, we're honored to welcome Dr. Michael Bagnell, a functional neurologist and chiropractic physician with more than 35 years of experience helping individuals elevate every dimension of their health. Dr. Bagnell has helped world-class athletes, top executives, and wellness-focused families elevate their health. His concierge-style approach goes beyond symptom management, using advanced technology to uncover the root causes of brain and metabolic dysfunction. Known for his warm, patient-centered philosophy, Dr. Bagnell empowers each person he works with, treating health as a lifelong investment rather than a short-term outcome. Dr. Bagnell, we're so thrilled to have you tonight here with us. Thank you so much for joining. To
Thank you for
begin,
the invitation.
of course. To begin, can you please share what inspired your journey into functional neurology and what continues to drive your passion for helping people achieve better brain health and long-term vitality?
It's a good question. I always wonder that when people ask me, it's like, okay, how do I approach this? Keep it succinct. But when I was in high school, I determined I think I want to be a doctor. I'm one of those kind of strange people that had a sense of what I wanted to do. And I wasn't that good of a student, but I thought, I think I like this. I can be my own boss. I like athletics. I like science. And so that kind of began the journey. And I went in a little different direction rather than medicine or medical school into chiropractic school, not really knowing what I was getting into. And those first 3 months there, I was like, I think I made a boo-boo. I'm not really sure if this was for me. But I ended up falling in love with it. As many of you might know, chiropractic is really, it's chiropractic medicine. It's an approach to using physical medicine to restore many different things in the body. And as soon as I graduated from there with my degree, I started into a postgraduate neurology course for chiropractors because I thought there's way more to this than just the spine and the joints and this type of approach. There's something about this nervous system. And of course, we had central nervous system and peripheral nervous system dissection classes. So I was very fascinated. But I got married, we had children, and it was time to put schooling to this back burner. Years later, I always tracked with the neurology aspect of what we were doing, trying to dig deeper and to get better results. I was always results driven with people. That every year around this time, I would think, what can I do better next year for my clients? What can I do better? How can I improve the quality of what I'm doing? And my wife and I are lifelong learners, like many of your listeners and viewers. So I started back into what then became neuroscience many years later. And I went into a fellowship program, which is a 3-year program on brain injury rehabilitation. And that just propelled me in another direction. So at this point, we do not practice a typical type of chiropractic medicine. It's really all clinical neuroscience based applications, and I'll explain a little later. And it's ways to help analyze the brain and then improve the brain by targeting neural structures, neural networks. Because as we age, and I'm there, I'm 62. So as we age, our brain starts to not be as sharp, not be as fast, not recover as well, besides my body, but our brain in particular. So after the fellowship, I continued in that area and did a few other degree seeking types of things where it was neurofeedback training, certification, hyperbaric oxygen. We've added that. So I've gotten numerous things that were necessary to help really put the best technology forward to improve someone's brain health. But you have to analyze it first. And that's really the key. So that's the short story. And what is part of the passion? My father, I saw someone from Montana there. My father, when I was a kid, had a very severe car accident. His brother lived in Montana. That's why I thought of that. And his brother gave him a car, a beautiful car. This is back in the early 70s. And my dad had a very severe head-on crash. and developed a brain injury, wasn't supposed to survive. Now, little did I know at that time that would influence so much more going ahead, right? How could you know when you're a young teen? But he survived that and dealt with many different problems and challenges, from mood issues to substance abuse, to difficulties with pain in his body and early dementia, which eventually caused his demise. And, he went to be home with the Lord. So it was an interesting beginning because it somehow influenced how I projected part of my life. I didn't do those things because of that, but I saw later, wow, I think that played a strong role. And now I really understand much more living with someone with a brain injury for over, 40 years. Wow, this is what it does to someone. So I'm very much about improving people's brain health and body health and getting them to have really the best functioning life they can.
Oh, I love that. Such a powerful story. Thank you for sharing. And I definitely agree with being the learners. I love seeing people show up to these calls. Like, we're all just like very eager to learn. And this topic is very interesting because our mental health series is very new and we haven't touched on this topic before. So, very exciting to hear you speak more. So, to get us started, when you're working with men in your practice, how do brain health and metabolic health influence each other? So let's set the stage with brain health.
Yeah, very good. Well, it's interesting because female population is underserved in research. There's not enough research done with women's health. Yet, when it comes to actual healthcare, women get a much better job on the healthcare. Men kind of like step back and like, no, 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 I'm okay, I'm
Mhm.
okay. So we need to help the men. I need to help the men. Kind of like, okay, here we go. I'm the same as you. I'm not that different. I kind of push it off. But when we're thinking about brain health, I think the average man will say, I'm good, because we see families come in and the wife is usually leading because she's done some reading and education. Maybe it's for the child, maybe it's for another family member. And the man or the husband will often be like, I'm good. How do you know your brain's good? So we like to do measurements, right? This is how we know our brain is healthy. And what kind of measurements would those be? Well, one of the key measurements that is non-invasive is to do a brain map. We put a cap on somebody, we measure the brain waves, and then we artifact and we edit those and come up with a brain map. Now, someone might have said, "Oh, I had an EEG in the hospital when I had a concussion, maybe," or someone they know had an EEG and it showed normal. So that's good. And they're looking for epilepsy, epileptiform activity.
Mhm.
We're taking the data and processing it in a particular way with normative databases, United States and Europe. We have two major databases for brain wave function, men and women, all different age, gender and age match. So we can see, are your brain waves as a man or as a woman, are they in a normal range, a range of normal? Are they 1.5, 2.5, 3.5 standard deviations out of normal, right? So let's say we'll take one of the five brain waves, alpha, and we'll say, wow, your alpha brainwave in the back of your brain, in the parietal lobe, is 3 standard deviations too low. And we know that when alpha is low in the back of the brain as someone is aging, they have a higher propensity for dementia. Now, that would be important, wouldn't it? So they say, no, I'm doing
Mhm.
pretty good. I think it's just my age. Well, there's so many factors, but now we're able to actually look at what's going on in the brain with brain waves and with firing patterns, what we call coherence. So that's just one diagnostic tool we use, all of our clients, men, women, and children. And especially when it comes to someone who says, I think my brain's pretty good. Well, let's find out. So I'm going to jump to one of the final questions you gave me. What would you recommend for someone to do yearly or every 2 years? Like someone might do after they're 50, a colonoscopy, a brain map. Get a brain map analysis with somebody in your region. And of course, we point people all over the country and world to people who do this kind of evaluation. It only takes you about 20 minutes. And then the analysis can give you so much data to help you understand, here's where I'm at, but it's actionable data. Isn't that great, Brenda? It's actionable, which means if the alpha in that example was too low, we can do things to help you improve your alpha brain waves. How would
Mhm.
you do that? And then, of course, we'd step into that. So That's one evaluation piece in the suite of evaluations we do that's very precisely and very sensitive to the way the brain is functioning.
And do you see when you have these brain maps and you're able to monitor the brain health, do you see any relation in maybe if someone has an issue with their brain health being reflective of their metabolic health?
Yes, 100%. So there are particular brain waves that when they are in a very high state, then we look to metabolic as a possible cause. So
Mm-hmm.
when delta brain waves are out of balance very severely, I'm always asking the question, and we do this anyway. I want to look at your lab tests. I want to look at your metabolomics test, another type of lab test, which tells us about micronutrients and organic acids. I want to look at your genetic profile tests. So if they don't have these, we'll help them get those tests so we can compare. And they may know what's going on. They may say, well, I'm a diabetic or I'm, grossly obese, right? Some people are on the new types of medications which are helping them, or they have Lyme disease, or they have et cetera, et cetera. So those types of metabolic conditions really affect brain waves and then affect function. So delta brain waves, just to go a little deeper, maybe everyone's interested in this, delta brain waves are associated with deep sleep. And deep sleep is your restorative sleep. So this is not the right watch, but I have another watch that I wear every night where I'm measuring my deep sleep, my REM sleep, my light sleep, and the stages, the amount of
Mm-hmm.
time. And I always recommend this for our clients. It doesn't have to be a watch. It can be a Whoop. It can be an Aura ring where you're measuring and looking at the sleep architecture because there's
Mm-hmm.
brain waves associated with that. And again, sleep is probably the most pivotal thing that we do daily to either make or break our metabolic health or our brain health.
And with the holidays coming up, I'm sure a lot of people are stressed. What are some of the first signs you notice that someone's brain might be under stress or not functioning the way that it should?
Oh, there's no stress around holidays. Why do you say that's not a thing. Well, I think everyone could relate is I'm frustrated with the people around me, right? I get frustrated. I feel like my bandwidth literally is shorter. I have a shorter fuse, this kind of thing. Or you find like, okay, I can deal with everyone coming over, but I'm having a few drinks, right? Some people like, maybe I only have one or two, but everyone's here and I need to have a few because of the social stress in the environment. May not be that way. But we look for, those are pretty standard things that any of us, we know most of us are somewhat aware of how we are when we're stressed. If
Mhm.
I'm not so aware, guess who helps me know when I'm stressed? My wife. She'll say, honey, slow down. You're moving too fast. Honey, and she's very gentle about it. You'll meet her later, ladies, and she'll be doing, I think, another podcast with
Mhm.
you in the new year. But she's a communication expert, I'll call her. So she helps to just look at someone's face. She's a highly sensitive person. She's an empath. So having someone like that in your corner is very helpful as long as you will take the coaching, right?
Mhm.
Like, yeah, so frustration, short bandwidth, short fuse. We say like 0 to 60 in like a second, drinking a little too much, maybe, other things. Maybe if someone uses edibles, that might be. If you see that you're going a little too far from where your normal range is, sleep helps, getting a little break. I know when my grandkids come over tomorrow, and we have four of them, the two little ones will be screaming, playing, and at a certain point, I'll have to like take five and walk into the back room because the sound can get to me and the people
Mhm.
talking and then the little boys like playing. And I've had a lot of concussions. So I know I've become aware of where my stress points are. And sometimes I'll work with those and back out of the situation a little bit and then come back and communicate. You got to communicate like, okay, we need a little bit of a break here. So
Um, I love that. Can you explain how neurological dysfunction can show up as brain fog, maybe poor focus, low energy? And are there any peptides you have seen that can help make a difference?
well, it's interesting. I started on a peptide journey about just before COVID, and I used them for several years, and then I backed out of them, and I went to optimize my testosterone. But with my wife's guidance and with LEMD, I've kind of come back into utilizing them. the testosterone optimization for men, ladies, if you're listening and you have a partner, a husband, it's definitely something he should look at and consider. So there's, of course, many different ways. What's worked for me the best, I used a lot of natural supplements for years to keep my testosterone a little higher. And like I said, after 30, it's going down and it changes just like estrogen. It changes their whole function. It changes the inflammatory process in a man's body. It changes their mood. It changes their libido. It changes their drive. It also, for me, it was causing me to be so sore from exercise that, I mean, just excessively sore all the time. And I train regularly just from my background. I like that. So when it comes to men, testosterone optimization is key. Also, ladies have a certain, of course, testosterone in there with their estrogen in terms of optimization. So getting with somebody who helps with that was big. The peptides, I mean, there's a couple there that have shown real promise. Like, and I'm not an expert in these areas, but I refer to people who are experts. So like synapsin, Semax, Celenk, these kinds of things. But what we really work with, my wife and I, are some of the ones that you all have. That's what we've been using. So we've been using those with quite good success. I like the NAD. NAD is really critical. I want to talk with us a little bit about that
Hmm.
and really where a specialty of mine is in functional medicine, part of my training, which is the mitochondria. So a lot of these peptides that you have are going to be very effective, at least as a first layer. And then someone might need something a little more specialized. But I mean, the ones that we're using now, BPC 157, TB 500, NAD, these are foundational and they're going to help with so many different functions, male and female. But especially for the guys, guys don't like to, I'm going to speak generally, we don't like a lot of many steps. So, I'll speak for myself. That's all I can speak about. My wife takes amazing care of her skin. It's like a few steps process. She can't get me to do it. It's just not going to happen. But she did buy me something that was kind of like an all-in-one thing, and it's really great. So, guys, peptides, very small needle, very easy. You can do oral, you can do nasal spray. There's different ones, and they have different benefits the way you're taking them. But so easy, gentlemen, so easy. Just a little pinch, little shot, done. It's such a simple process, and men are simple. I mean, we're, you know, we like things very simple, generally speaking. I mean, I don't mind some things that are multi-steps, but it seems like I'm a little more of a simplistic kind of approach with things. At this point, 35 years in healthcare, I've seen a lot of things, as you can imagine, and a lot of things that are going to change everything. I'm not so sure about that, but I will tell you, peptides are pretty close to changing most things now. So I think it's wise to pay attention and have your
Yeah.
wife order them for you, and then just lead, listen to your wife. It's probably the best thing I ever do when I say, she's right, that's correct. She's a great, I wouldn't even say help mate, but she is like, without her, it would be a whole nother story.
Yeah, I love that. Yeah, especially with NAD, I think, oh man,
NAD
it's
is
definitely
huge.
a peptide that I will keep using for a really long time. So I think I'm on like my third, fourth cycle of NAD. But I would love for you to share more about the mitochondrial side of NAD.
Yes.
It's definitely one of our favorite peptides, like not just from the LEMD team, but LEMD customers as well.
Yeah, absolutely one of the most important things. So I was doing NAD IV with glutathione for a while, and it's very difficult to do that
Mhm.
actually because you feel like your heart is racing at certain points. It's almost, I don't suffer with anxiety, but it's almost like you feel like you're having anxiety for a part of that when it's going through your system. And I've worked up to higher doses. The after effects are dramatic, but there's none of that kind of struggle when you're using peptides. So I always question, when I go back, I'm like, okay, do I want to do this again? It's going to be like a 45-minute real like heart pounding blood. I can feel the blood moving and through my legs in a way that I don't enjoy. I can tough it out, but it's peptides with NAD are completely easy, and I feel like it's a much gentler approach. So
Hmm.
benefits the same. Benefits the same. So let's talk about mitochondria for a moment because this is really the key. So in every cell of our body, there are these little engines, if you will, mitochondria, and they generate energy, ATP. And this is the I'm taking this from another physician, a biochemist out of California, actually. This is the currency of life, ATP. ATP being low, you're in trouble. ATP being high, your body is healthful. In fact, there are some people in longevity medicine out at University of California in Berkeley and then in Stanford that have looked into the fact that when your mitochondria start deteriorating, this is when aging starts to appear, disease, disorders, and there's even a mitochondrial dysfunction national organization because many diseases are linked to mitochondrial problems. Okay, so these little tiny things in the cell. Now, for those mitochondria to be functioning properly, they have to have certain things fed to them. And they're like engines, so they're creating oxidative stress, normal oxidative stress. They're creating like the exhaust from your car, right? Now cars are much cleaner, especially if you have an electric vehicle. But think about the old cars with the engine and the fumes coming out. Well, think about those fumes are like the mitochondria producing energy, the car's moving, but you're having this waste product. And that's your reactive oxygen species, ROS. Okay, so we have these engines in every cell of our body except for one kind of cell. Do you know what kind of cell that is, Brenda? That doesn't have any mitochondria? A friend of mine who's a
I'm not
medical
sure.
doctor, he questioned me this weekend. I was like, no, I don't remember, Scott. Which one? The red blood cells. They don't have any
Um,
mitochondria. And the cells, just an interesting fact, the cells with the most mitochondria in the human body are an egg in a female and a sperm in a man. They have the
mm,
most mitochondria because they have motility and reproductive capabilities. Just an interesting fact. But the mitochondria are really crucial. So you have to get things across the cell membrane into the cell so the mitochondria can utilize that for metabolism. Okay. And you have to detoxify in a way the exhaust or the waste, the reactive oxygen species from the mitochondria. So I know this is getting a little bit in the weeds, but stay with me because I'll finish it up. So you can't get anything into the cell if the cell membranes are not healthy. How do you know if your cell membranes are not healthy? Omega-6 to omega-3 ratios. If anyone knows about that, just kind of pop your hand up. So omega-3 to omega-6 ratios. Oh, I see someone had put the MOTS-C. That's right. That's another great mitochondrial activating peptide. Yeah, thank you for reminding me about that. So these cell membranes, our cell membranes, cardiac cells, muscle cells, liver cells, neurons, they have a double-walled membrane, which has a fat, so to speak, and then it has these little chains. So you can see these things, you can Google it. What does a cell membrane look like? Well, those cell membranes, if you have too many omega-6s in your diet, or you have had, which would be things like corn and soy and these types of things, which are in just pervasive in our food supply, right? They're fed to different things, cattle and so forth. Even fish that are farmed, some of them are fed grain-based mixed supplement. It's just terrible stuff. So we really need wild caught. We need, farm, things that are free range as much as we can because those animals, if you're eating that, if you're not, if you're a vegan, different story, have more omega-3s. But omega-6s, which are normal in our body, should be in a ratio to omega-3s of 1 to 2, 1 to 3, 1 to 1. But the average American tends to be around 25 to 1. So you have many more omega-6s. So our bodies become pro-inflammatory. So I stumble in my gym in my garage today, which I did, but I'm okay. And I bang into something, and now I have an injury, and it lasts me 6 months because my body has this chronic level of inflammatory profile. But more than that, it doesn't allow me to get the best out of those mitochondria because I can't pass things through the cell membrane. Peptides have to bind on the cell membrane. That's another thing. So if the peptides can't bind properly, then you're not going to have the best benefit from your peptide. So many years ago, and this is not based on my research, but many people I worked with, Dr. Floyd Chilton, who wrote Inflammation Nation, he's a PhD, and he said, you got to change the profile, the ratio. So I started taking in high doses of omega-3s, a very good quality fish oil. And I recommend that for everyone. Still, you can't get around that. Some people say, well, especially in South Florida, I'll eat fish. Good luck. You have to eat so much fish, and they're the small fish, right? You have to have the sardines and these types of fish, which have the higher oil content. At any rate, we want healthy cell membranes, so we're using omega-3s. So we get the best response out of our peptides. And I would say,
Mm.
my opinion now, just my opinion, everyone, if you have one person with a omega-3 to 6 ratio of 1 to 3, and you have someone with 1 to 25, and they're both doing peptides, two men, the smaller ratio, 1 to 3, is going to do so much better. And
That's
I don't know why
interesting.
it's not working for the other guy, maybe because your body is pro-inflammatory. So we have to think about the whole person. Yes, we want to use peptides. And I would add something to try to make sure, because nothing is the answer for everything.
Hmm.
You have to make sure the body is ready for whatever we're giving it to get the best out of it, especially when it comes to peptides. So we're utilizing peptides. We've always been in this mitochondrial support type of conversation and cell membrane conversation as well. That's a
I
lot
love that.
to answer. I hope that's not too much.
No, that was perfect. And it's as you mentioned, there's a lot of these peptides like NAD where it's tackling a lot of things. It's not just like the energy boost, it's the mitochondrial side of it as well, and also the inflammation. I want to get into our next question for inflammation, but Melinda's comment kind of stood out to me because you had also talked about communication. And she says that she's an esthetician and it's like pulling teeth to get them. So I'm thinking men in this case to use home care. But yeah, definitely having that communication in place. And before we get into inflammation, how can men recognize when their brain performance is starting to decline and they may need deeper support?
Yeah, how can men recognize that? Well, they may recognize it, but they may write it off. You got to realize the kind of animal you're dealing with, ladies. You know what I mean? The kind of animals that we are, I'm using that in a loving term, not in a pejorative way, is, we, I think it takes multiple suggestions. And sometimes of like, even like our kids, they have to hear it from someone else, from another man sometimes, or from a friend, on the job, sometimes it just has to be gentle things. I know what doesn't work because I see it in our office with people. You should. That never works. That doesn't work with teenagers. That definitely doesn't work with men. It doesn't work with ladies. So, you got to consider, how am I going to maybe leaving things out, but making it as simple as possible. And I think sometimes, unfortunately, a health crisis can change their direction and they start listening. We start listening. Yeah, I think that's part of it. So, yes, I don't have a secret sauce for that, ladies, but I think that understanding their core values a little more. What is very valuable to your husband, his core values. Understanding, this might sound like off topic, but understanding his love language, just like he could understand yours. These are very helpful things to start being able to speak a little bit differently to each other, especially if you're trying to help him and he's got the resistance, the male resistance thing. I think the XY gene, the X is like the resist, the YG is like the resistance. So I don't know what the problem is, but just gently encouraging. It might take years, it might take a health crisis. But I'm usually following those pathways that my wife is opening up, and I know the darn pathways, but I'm still resistant sometimes. So yeah, I mean, praying is never last. It would be first if that's part of your faith journey. Just praying for an opening. We do this, we've done this, we have adult children, 38, 37, 31. So, you wait for the right time, pray that you would be in the right space. My wife helps me a lot with that. Like, timing is everything. Timing is everything. So you got to know when to say something and when not to. But I agree with you, Melinda. It's not easy, um, but hopefully they're worth it.
Yeah, Mr. says the frying pan.
If not, yeah, if not, get them a higher life insurance policy. What can I say?
And now, going back into inflammation, how does chronic inflammation disrupt brain performance and long-term cognitive health?
Yeah, this is really important. So we're talking about inflammation systemically in the body from what we're eating, right? The ultra processed foods or things that are corn, soy, all this kind of grain-based foods, rather than having more fish oils and greens and whole-based foods. So that can create an environment. Many of you may remember the old charcoal grills, right? You put the lighter fluid all over it. That's what I'm talking about. That it's not lit yet, but all it takes is one match and woo, the whole thing goes up. So that's that pro-inflammatory state in the body. But inflammation, whether it's from immune, which creates inflammation, or whether it's from blood sugar elevation and obesity, which creates inflammation, whether it's low testosterone, creates inflammation, and the food supply. So we got all these things that could create an inflammatory status going up. The brain does not like inflammation, nor does any organ. But the brain is very sensitive. It's an electrically signaling organ. And so when you change the inflammatory profile in the brain, which also has these fatty acids in there, and ladies, if your men are on statins, that's something you need to learn more about and maybe try to help them with a functional medicine doctor, because statins are not good for the brain in the long term, not good for the brain, and many other things. So yes, there's a whole conversation to be had about cholesterol and things, but yet, there's a bigger conversation to be had. So I don't just tell them, get off the statins. I say, okay, let's talk about this. And are you taking fish oils and so forth? But the inflammation in the brain starts to damage neurons and synaptic connections. And if we're trying to create plasticity in a brain that's already slowing down, it's like not going to happen. There's no way. So we have to lower inflammatory profiles, which we do on the front end with clients. When they come and visit us, we have people come from around the country and they may stay for a 2 week, what we call immersive. Before they even get here, when we have one-on-one with them on a Zoom, we're looking at the labs. We're looking to how do we lower the inflammatory levels in this particular person's life before they even get to us, so that the work we'll do will be much more successful in developing neuroplasticity. So inflammation in the brain, not a good combination. Does alcohol create inflammation? Anything that damages neurons, as they are damaged, they're going to create an inflammatory cascade. So, Dr. Daniel Amen talks about alcohol. A friend of mine, Andrew Huberman, talks about alcohol. They have some great things there. If you're trying to help somebody and the alcohol is even 1 or 2 drinks a night, that would be a good place to help. And my wife and I enjoy good wine. We enjoy that. But there's got to be kind of a limit on those things, especially when you talk about inflammation in the brain.
Hmm. And is there a difference between maybe symptoms showing up within men versus women? Like, what are some clear indicators that inflammation or poor detoxification is might be driving some of those symptoms?
Or detoxification. Oh, I saw that question, so I wrote down here. Um, well, people can have brain fog. But the thing a lot of people have is sleep issues as you get older, right? I mean, younger people do also, but sleep issues when you age is really a indicator that something's not right. Of course, it could be many things. It doesn't mean just toxins. But one of the best ways to kind of figure out, do you think I have kind of a lot of tox? I just did a detox with my wife, a 7-day detox a week ago, and she modified it for me and it was helpful. And I pushed back for a while. No, I don't want to do that. And I was joking with her. I said, right before the detox, I'm going to do a pre-tox. And then afterward, I'm going to do a retox. She was like, you're incorrigible. But I did the 7-day detox and I noticed things in my body. So to me, it was signaling, you kind of got a little bit of blockage maybe in some of these liver detoxification pathways. Why? Because I'm 62 and this is life. Even though I eat pretty healthfully and I exercise, it still gets sluggish. And so it's a good thing to do kind of something, but I would keep it small, ladies. I would keep it small for the men. For the men to begin, might just be a couple of days, and it might be something like soups and bone broths and things, and then supplemental shakes that support that. Actually, we work with a very good program on that. And reaching out to us, we can help direct people to do that on their own. But it's very helpful. And that's a great way to see sometimes is, do I feel like I have toxins? Some people, because they can't lose weight, right? You have, this happens with a lot of ladies, but men too. I get maybe 8 or 10 pounds, but I can't drop more. What we see when they do a detox, all of a sudden they drop another 5 on top of that already 5 to 10. And so that's an indicator that maybe the toxins were holding on to a lot of that extra weight also through different pathways. So brain fog can be a sign that there's detoxification issues. Skin issues can be a problem, uh, 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 show that there's detoxification issues. The abnormal bowel movements are a very good indicator of that. A lot of flatulence, a lot of gas, stools that are floating, stools that are not regular, have to have coffee to go to the bathroom or cilium. See, when you have the systems are dysregulated, then those may be indicators that there's some buildup and we need to kind of flush the system out a little bit. They also could be indicators of things going on in the brain. So it's easier to start with something on your own in a short detoxification process. And there's a way to do that, not just like a modified fast, but supporting phase 1 and phase 2 of detoxification. Those are critical nutrients that need to be going in while you're doing that detox.
And what was your detox process like? Did you include any peptides? Because what stood out to me was the mention of sleep, because I started with Tessa IPA and it's been amazing for sleep. At least for me, I feel like I close my eyes and then the next thing I know, it's 7 a.m. the next day.
That's fantastic. So you're using that combination. So these things are well worthy of a trial, right? You have sleep issues. I like people to check what their sleep looks like, then use that. Then you can, my sleep is better. Oh, wow, it's really better, right? Because we're notoriously poor, and there's actually a study on this, notoriously poor at accurately depicting the type of sleep we get. I mean,
Hmm.
they actually did a study on that. Can you imagine? I don't know how much money they gave them, but for people to evaluate how they sleep. And that's where they came up with the Pittsburgh Sleep Index study, which is the gold standard.
Hmm.
You fill out this form, you probably get a PDF and see what your sleep is really like on the scoring. Then do something like that, the same peptides you use, because that's a great testimony, and see if it really influences that. And then a month later, do the same inventory. You could do that for free. And that's a great way to
Hmm.
see. I love to measure, measure, measure. That way I
Hmm.
really know because it kind of bothers me when it's like guessing, maybe, could be. I don't like that. I like to, what do we really know? I always start with that with our clients. What do we really know? Because we get cases and we get people that come with all kinds of issues. Yes, we have the high level athletes and people that want to perform better, entrepreneurs and things. But we also have people that have had concussions and Lyme and POTS, dysautonomia, and movement disorders. So these people, what do we know about what's going on with you? And that's what we're going to focus on. We're not going to look at things or like that could be something, maybe. Oh, I don't like that.
Hmm.
Like I like to look at what we can see and figure out, through
Hmm.
so many different tests that are non-invasive, where we can get an excellent idea of what's going on with somebody functionally in their brain and functionally in their metabolism.
Hmm. Yeah, Misty says it's all about education. Most people are shocked when that conversation happens. Sleep is core. Definitely
I can see
agree,
questions.
Misty. And Kelly asked a question. Would NAD help combat the negative of a statin?
I would say my opinion would be yes, Kelly. I would say yes, because the NAD is going to help in the mitochondria, in the electron transport of that. And we know that that statin is decreasing that mitochondrial function. So I would say yes, right? We also know that a statin, there's a pathway of the use of our body makes cholesterol. Most of you probably know that. So the body makes cholesterol, and you can also take it in dietarily. But your body's making it, and it uses the cholesterol molecule for CoQ10 in this pathway, vitamin D, and your sex steroids, your hormones, testosterone and estrogen. So if you take statin, you start knocking out CoQ10, you knock out your vitamin D, you knock down your sex hormones. So all of those things need to be looked at in lab work, which I would say rarely and none does that ever happen with the people we've seen. Doctors are never testing that. Some of them are recommending, yes, you should be on CoQ10. But you got to look at all these things to properly take care of the individual. And so I think it would probably be a good help. I would also add those other things potentially as a functional medicine doctor would guide you with that, Kelly.
Hmm. And going into peptide therapy a little bit more and just men's brain health, Have you seen any peptides stand out as the most effective for supporting brain health or cognitive performance?
Hmm. I would say I don't have enough background in that yet.
Hmm.
I don't have enough background because remember, 5 to 6 years ago, you couldn't get these things very easily. This is a whole different world right now with LEMD. I mean, this is like groundbreaking that people can do this with you all. This was not available. You had to get with somebody who was doing it, and I had a guy who's a firefighter and a nurse, and I would, get with him. So it wasn't that easy, and you couldn't even get some of them. Now all of a sudden they're available again, which is brilliant. So I don't have enough background, but I did do a little bit of looking into things like cerebrolysin, really helpful for oxidative stress in the brain, dihexa, and Cemex. So these are
Mm.
three, dihexa, cerebrolysin, but these are not ones that LEMD has or many other places. So people would have to do more research on their own. I do not have enough background in that yet, but check back with me in 6 months and I should know a lot more.
Love that. And I don't know if you're able to answer this question coming in from Michelle, but she says that her stepson is high functioning, autistic, and has severe ADHD, but has an issue with executive functioning. He's only 14. Is there anything that they can do for your children?
Yeah, I saw that earlier. Yeah, so Michelle, so he's high functioning. So he sounds like he may be dealing more, he's more on the Asperger side and his executive function. So when we have a young guy like this and we look at that, we map their brain. We also do eye tracking studies, oculomotor tracking with some very advanced technology. We actually use a pair of goggles that are the same ones the company makes them for the International Space Station. So they're very high tech and we can look very carefully. Now, why would we look at eye movements? Because eye movements are the best indicator of the neurocircuitry of the brain. So we get a brain map and we get eye movements. So when we look at that with a young guy like yours, we start to know, oh, it's more in the right frontal lobe that we need to actually increase firing or plasticity, or the left, or we need to work on both because certain eye movements will tell us about the frontal lobe or the cerebellum. So we would
Mm.
develop, and this is how we go about developing targeting exercises for those areas of the brain. So executive function is going to be frontal lobe, dorsal lateral prefrontal cortex, frontal lobe. But remember, the cerebellum has direct links to the frontal lobe. So you may not be able to train the frontal lobe so well, but we can train the cerebellum because that's all about coordination. So we would do a lot of coordinated activities with him, start driving that frontal lobe, and then give him some executive function things like we have some targets. And whenever you see a red target, you touch it, but don't touch the blue ones and he's touching. So he's having to make a decision. Oh, that's red, that's blue. Whenever you see a large target, you touch it, not a small one. He's having to make a simple decision. So you have to train up the pathway. You don't just like, oh, executive function. Let me give you a list of chores to do at home. That's not training. That's overwhelming, typically.
Mm. Mhm.
So, this is the thinking. You have to be in this spot and understand, okay, what's going on first? Just like with LEMD, you need to know what's going on with a person before you say this and this and this peptide are going to be your best option. So we need to know what's going on with the brain. That gives us a good insight into that. I know the cerebellum will be involved in anyone that's on the spectrum. How much? I don't know. I have to do evaluation. And then also brain mapping would help us. Brainwave therapy might be very good for that frontal lobe in improving executive function. You see how it kind of the different pieces, you just have to kind of triangulate what would work there. But Michelle, yeah, any questions that we might help you with through social media, I think you'll mention that at the end. We'd be happy to help direct you and guide you with a little more particulars for your guy.
Amazing. Thank you for answering that. And I know towards the beginning you mentioned about doing the brain mapping. So for men who are wanting to take charge of their health, besides doing maybe labs and brain mapping, where else do you recommend that they start?
For men, I think one of the key things for guys is if they're, over 30, men over 30, so let's say over 35, is they got to make sure their blood sugar is in good shape and their testosterone is optimized. Those things are really important because those are going to influence brain health. In fact, they call it colloquially type 3 diabetes as early Alzheimer's. So if you're already having blood sugar problems and you're 35, your testosterone is probably low also because of that blood sugar, and it's already going to be creeping down. If you can optimize those two things, and those are going to be lifestyle things, right? We don't just say, oh, take this shot for this, although there are help with that, right? With the trizepatides and things. There's help, but I want you to change your lifestyle. And so we'll give them some things to do. I don't just say it like that, especially with the
Hmm.
guys. Like, okay, the first thing we're going to do is we're going to be doing this, a walking exercise. We're going to be doing a bike exercise. We're going to be doing a stationary bike. And this is what I need you to do as we're in the therapy. So we're looking at changing of lifestyles, eating profiles, exercise, so blood sugar, and then optimizing testosterone, and then also looking at their foods because their lifestyle might be suppressing or breaking down, whether they're taking in xenoestrogens and things, they may be making it worse for themselves. Inactive, high sugar diet, smoking, or vaping, just as much of a problem for most people, if not more. Um, too much weed. Well, I need weed every night to sleep. Okay, there's a problem in the brain. If we need alcohol or weed or Ativan or a benzo every night, something is off. And so I'm always looking to get behind that because I'm concerned with the long-term well-being of these guys. That's what I'm concerned about. How can I help you with your long-term? And when I talk to them, it's very different than, of course, their wives because they're like, okay,
Hmm.
you're one, just like when you ladies talk to another lady. She's one of us. She understands my struggle. I know I'm the same as you. I tell them I'm not that different. I know what to do. I do a little of it, but I can help you through this. So they tend to respond pretty well to that.
Oh yeah, and I definitely agree with lifestyle changes are so important, like just in general for your health, but like even just to see peptides like really bring out their full potential. It's not just taking a
Yes.
GLP-1, you still got to make the diet changes, the exercise, we still got to put that in. So 100%
Yeah.
agreed on that. Well, thank you so much for joining. I know we're running up on time and it's the day before Thanksgiving. So,
Yeah.
if anybody wants to reach out to you, ask more questions, where can they find you?
They can find us at Bagnell Brain Center on the web, right? Bagnell Brain
Mhm.
Center, all one word, Center. And you can find us all Instagram. Instagram has a pretty big following. You'll see videos that we put out all the time to help people understand what to do. We also have our podcast, which is the Neuro Collective podcast, where my wife and I have a great time talking and sharing things about the brain, body health, peptides, you name it. We talk about it. And sometimes we even joke with each other. It's quite funny sometimes. It's very entertaining. So Neuro Collective podcast on Spotify and Apple. So Facebook, Instagram, Facebook, I guess if you're older like me, Instagram, TikTok, all those things. Bagnell Brain Center. Reach out to us. Happy to help you. Email us, bagnellbraincenter at Gmail. My wife is the lead on that. She's our center director, and she's an amazing woman to talk to. You'll absolutely be pleased that you reached out. And follow us on
Amazing.
that podcast. I think you'll like it.
Yes. I linked the Instagram and the link tree. So all of their podcasts, their website is on that link. And as Dr. Michael mentioned, we'll have May as well come on and talk come in June. Not June, sorry, January. So I'm very excited to have her on as well. And again, thank you so much for everything, Dr. Michael. We'll definitely be having you back. And thank you all for also tuning in, especially the day before Thanksgiving. Thank you so much. And I hope everyone has a great rest of their night.
Thank you, ladies and gentlemen. Take
And
care.
gentlemen, yes.